textbooks, dermatology, primary care. Throughout our lives, we will all interact with the healthcare system. So, what happens when that system is not designed with certain groups of people in mind? As a Black person in America, I have experienced firsthand racial disparities in healthcare. The turning point for me came during the pandemic when at a local clinic, I was asked if I had a red rash on my skin. At that point, it dawned on me that some healthcare professionals did not realize that skin rashes do not exhibit the same way on different skin pigmentations. If something so obvious could be so casually overlooked by a healthcare professional, what other elements of care, treatment, research, and education are also being ignored, and what does it mean for people of color using this healthcare system? I am Vivian Kopsinger-Birchall, and in this series, we will take a closer look at disparities in healthcare, speaking with medical professionals and hearing personal stories to get a better understanding of those disparities and explore ideas and strategies for how to bridge the gaps. Welcome to Healthcare Blind Spots. I'm Vivian Kopsinger-Birchall, your host, and today I have a special guest called Barnabas Nkore, who works in the healthcare system here in the United States and also works in Uganda in some ways. And he'll tell us more about what he's doing in the healthcare system. Barnabas, welcome to the show.
Thank you, Vivian, and I can't thank you enough to bring me to your special show. I mean, I have been watching your shows for a long time and have seen very many big people sit in this chair. So looking back at where I come from and being considered one of the guests in this show, it gives me pleasure and a lot of grateful. I'm very grateful to be hosted by you.
No, thank you, Barnabas. You are big. And
No,
you know, my goal when I was creating these shows was to really have the diverse voices, perspectives, experiences, because we all have something that we contribute in this world. And that's why I'm excited to host you today, to talk about, healthcare blind spots, maybe in your career, but not just the blind spot, but some of the experiences, best practices that you've seen along the way. But first, to kick us off, tell us more about what you do and what inspired you to do what you do.
So I'm always often afraid to tell what inspired me to do what I do. My whole entire school career, I was in the seminary school, so I wanted to become a priest. I am always hesitant to say that, but I can tell you how beautiful that formation contributed to my personal life. I am who I am because of that background formation. So I could not. And so having failed to take care of people's souls, I decided that maybe I would take care of the physical bodies of individuals. So that's how I turned out to be a registered nurse. And so that has been a phenomenal career for me for the last 18 years.
Wow. And it's, in a way, it's saving the souls, because when you're dealing with the physical, it saves mental health, it saves everything. So you're not far off from the target. I won't dare ask why you failed. But anyway, going back, because you were an RN, that's what you said, right?
Yes, I am.
Nurse. So what has it been like for you as an RN in the United States? What are some of the experiences you've observed in our healthcare system?
So the nursing career in the United States is an amazing career, and I wouldn't spare any good word about this career. For the last 18 years, I have worked in long-term care setups. I have worked in acute care settings. Leahy's our neighbor here. I have worked in home care, and I actually, not until I discovered that working with the dying, and that's hospice, I found that's where my passion is, and I have never turned back. However, the beauty of this job is that it's very flexible. You can do your own schedule. So I have plenty of time on my plate. I work every other week for a pay of I work 2 weeks in a month for a pay of a whole month. So I have 2 weeks off in a month. So that gave me to explore. And the beauty of nursing is that career opportunities are so many. You can specialize in med-surg nursing, you can specialize in administration, you can specialize in long-term care, you can specialize in anesthesiology, you can work with dialysis, you can work with children, everything. Now, so that's where I decided that, I can use this free time to bring more services to the community around where I live. And that's where I started a small home care business, which is called Vantage Care Inc.
You chose a particular niche to work in. What inspired you to do that? Why home care?
Home care is also, it's a great opportunity to meet individual clients or patients in the comfort of their homes. I mean, the benefit of taking care of someone in a home. And with Vantage Care Inc., it's a small company. Have seen big companies that are consumed with numbers. But when you look at the small numbers that we have, we really pay attention to the needs of our clients, and we leave these lasting memories of personalized care. Like, yes, a nurse came to my home, had spent my time, answered my questions, took care of me, and satisfied my needs. And so, and also, I don't know, being a male nurse, it lives, they remember male nurse, because I think, because we are, excuse me, because there are not many male nurses out there, it has worked for me.
I hear that. But anyway, so back to the home care. Why is it important for that personalized service that you are speaking to?
The future of healthcare is in the homes. Think what COVID did to us. All hospitals were filled up worldwide, and it was no joke. Some people died of diseases that couldn't have killed them. But so home care is a service that is really going to be the focus of governments, departments like the ministries, or say a case of Uganda. I mean, the governments or African countries, they need to start to put more focus on providing care at home. The way it works in the United States, we have plenty and many home care agencies, businesses here, and that is really helping, supplementing the work the doctors and healthcare institutions are facing in the US. Otherwise, they wouldn't have enough beds for all these people we take care of in the comfort of their homes.
Right.
It's a big help, and care which is personalized. You can't beat that. And people don't want to be in the hospital. Think what happens to the hospital, the attention, the comfort. You have grown in this home, you have lived in this home for 50 years. People don't want to leave the comfort of their homes. So finding them in their homes and giving them the care they need, it actually helps them to heal even much faster and heal better.
I like your statement that the future of healthcare is home care. And so that's a great segue into your work in Uganda. I know you live in Massachusetts, you work in Massachusetts, but you had this calling to start Vantage Care in Uganda. How did that come about? What drove you to provide that service, and what kind of service is it?
So my mother is 81 years old. My mother is diabetic, and if you have diabetes, your sight is limited. When you have diabetes, your kidneys are affected, so she urinates frequently, and being 81 years old, her hygiene skills is very poor, so she's very high risk for or prone to urinary tract infections. When you have diabetes, you have neuropathy, you have no feelings in the extremities, usually the feet. And so my mother doesn't care whether she's walking on her feet, in the gardens, on the farm. Every little thing that scratches your skin, it can end up becoming a very serious wound, and once it gets infected with poor hygiene, we have seen so many amputees of diabetes cases. She's also hypertensive. So she forgets to take her medications. Why? Because she's old. Maybe the medication tastes bad, or she doesn't want to feel like she's one of those sick people that have to take medications every day, in the morning, in the afternoon, at night. And she doesn't want to remember that she's sick. That's why she avoids some of these medications. And 3 years ago, she was hospitalized. Like almost every 3 months, she was going to the hospital because of poor management of her diseases. And so, and not until when we put someone who makes sure she takes her medications every morning, who makes sure she takes her shower or she's clean enough, someone who makes sure she has infection is in control, she washes her hands, her body hygiene is maintained, make sure that her diabetes levels are maintained, because once you can't see, you can't prick your finger and check your levels and know that I need to take insulin. So there's a girl that lives with her that has been instructed to go to live with her, and they, that's the beauty. She has spent 3 years without going to the hospital. And I can tell you how much we have saved on that. Yeah. My mother is very stubborn. She does not want to leave her home. The last time she went to the hospital unconscious. And the neighbors thought she would never come back alive. Thank God, we had her revived, and she's back home for the last 3 years without hospitalizations because of simple basic care, and this is provided by home care services. So Uganda, this is only one case of my mother.
Right.
I mean, it's a country that has not considered home care services as a priority. Mm-hmm. So we don't have home care services in Uganda, and like many other African countries, I would say.
Is it a cultural thing?
Yes, because it's a misconception. Today, with modernization and education, it's a situation that I saw my father take care of his parents, my grandparents, because they were in the village, in the community. But today, we were born 10. But none of us is close to my mother. They are all 100 miles away from her. Mm. So, I mean, it's like a paradox. I mean, you give birth to children, you raise them to higher standards of education, you pay, you feed them, and they find their own homes, they live away, and you find that, like any other elderly people, it's a category of people that are isolated, neglected, and abandoned. Mm. My mother is considered to be abandoned. If you wanted to see how often we visit her, right, it really takes a long time. It's not our fault, and it's not her fault, but I think coming together and saying, let's give back to the people that raised us, the fathers and mothers of our nation. Let's provide support that can prevent sickness, right, hospitalizations, and suffering. I mean, it gives them a lot of quality of life and dignified way of living.
That's a very, very personal yet, huge story that I think many of us can resonate with, especially we who come from motherland, Africa or Uganda to be specific. These are some of the things we took for granted growing up because we grew up in very communal settings. But as, like you rightly mentioned, as the world has evolved and we've become more modern, more exploratory. We are here in the United States. Our families are back in Uganda, so I can resonate. But even here in the United States, we see many isolated seniors, and I think that's where working in healthcare, home care, it comes in sometimes. What are some of the comparisons? So
the comparisons are totally different. Here, families understand that their loved ones or the old, the aged, and also the categories of the of the disabled, those people with developmental challenges. The country here is well established and structured in
Right.
a way that no one is left behind. There's the Department of Social Services takes care of so many categories of these people. Department of Public Health here is an amazing department that looks out for people who need this kind of services. I mean, you can't run away from this kind of system. What are the words to explain about the US? By the way, when the US says that they are a superpower or they are on top, they are right. In one way or the other, you can't beat them. They have set up their own standard, and it's amazing. And so I'm very jealous of them. And so
Well,
they
we should say we are part of it because we live here. It's our home
yes,
now. It's of us.
and that's the reason why the little that I know about home care, really, if I could share about what I know about their system with a poor country like Uganda, a developing country
There we go.
like Uganda.
Developing.
Yeah. So, and that was the main drive, that if I could make a difference, maybe I could shed light to people to the departments, to the people who are in power, people who are in position to accept services like these basic services of managing our old people, the disabled, the developmentally challenged people in the community. Maybe they could pick a leaf and say, you know what, maybe this affects every home state. Maybe let's rethink about how do we bring back an appreciation or services to the community, to the people that need them. I mean, old people have their needs. The disabled have their special needs people. And so that's how I think Vantage Care Limited Uganda will bring a difference to the communities.
And so what are some of the specific services you provide with Vantage Care, and how have they been received so far?
Life expectancy in Uganda has increased to 67. From 45 to 50 years old there. And we have a growing population, and actually it's projected that in the next 20 years, a country like Uganda will have a population of 75 million people. Now, so, yeah, people no longer die at 45, at 47.
And we are having high fertility rates.
Yes, we have very fertile girls and women, so to say. And that has, in Uganda we have the highest youth population in the entire world. So there's this, it's like the population explosion of the US. We have today 80 million baby boomers coming on in the next 20 to 30 years. And that's actually the opportunity also nurses have today. The job growth is going to be 7%.
Yeah, I was reading an article yesterday about the population. Certain countries in Europe and Asia are struggling because they are losing young population. So they are urging families to produce more kids. So
like they can adopt Ugandans.
True.
So, yes.
Anyway, back to Vantage Care.
So back to the population of Uganda. So in the next 20 years, we are projected to have 10 to 12 million elderly people in the country. So these old people, growing old doesn't mean growing healthy. You can see it from here. At 50, we have a number of non-communicable diseases that affect our bodies. The healthcare system is overwhelmed with people who have heart diseases. Think about stroke, number one disability among the adults. It's in the US. Cardiac diseases claim 1,000 lives a day. And
wow.
That's due to our lifestyle. And this is not going to change tomorrow unless we change our lifestyles. But let's go back to the elderly. Like I said, my mother, 81 years old. Look, there must be some pain related to joints because of arthritis. Yeah, so these are the people that experience pain, but they don't know why they have pain. They think it comes with age. So if someone has joint pains, that means they can't walk steadily. So some of the things when we go in, we prevent injuries related to falls. And when the old fall, their bones are already weak. So there's high risk of a fracture. And once you have a fracture at 81 years old, it means you're going to be bedridden for the rest of your life. If you are in bed and you don't have someone who knows that, repositioning you in bed, and also the way of repositioning you without aligning the hip that's broken, it causes a lot of pain. So we have these services, these skills educated to the people that we train. Say you prevent falls, and by preventing falls, then we don't have injuries, then we don't have wounds. That means, wounds, once an old person gets a wound, a bed ulcer, it ends up getting infected, and if it's infected, then they die of sepsis. So we prevent those kinds of, those are the services we are providing. If someone has diabetes, we know that we have to clean the area where you're going to prick in order to read normal levels of blood sugar. And then if the numbers, they only have to know a certain level of numbers will require insulin or the blood sugar is normal. Reminding people to take their medications is key, because they don't want to take medications, they forget, they mix up medications. So these are services that we help our clients in the community to keep updated with. Other diseases that come with age, of course, kidney diseases, respiratory issues, pneumonia. There are people who have congestive heart failure. And so think about a patient with congestive heart failure, CHF. We got to know, the doctor needs to know if we find that the feet are swollen next morning, then they know maybe the medication is, did they take their medications? Is the medication working or not? And so by having someone who knows what to report, it helps the doctors so much than finding their patients already admitted for exacerbation of the disease. But if we communicate such kind of a symptom, then they know, maybe we can increase the medication. Can you go pick up this medication, maybe double it and see what happens? Absolutely. So we prevent a hospitalization like that. We also have Parkinson's diseases in the community, neurological disorders that are on the rise. Talk about forgetfulness, dementia, the way they treat our people when they forget their loved ones. It's very unfortunate that our people don't understand that this is the symptom of the disease. They think, yesterday my mother was able to eat, today she didn't eat, even when we put food in front of her. They don't know that the disease tears can be on and off, and we see people losing weight because they don't know that they need to help them feed, because they can't remember. These people will look at their children and they don't remember them. Very sad and very tough to deal with. And so someone to deal with a client or a patient like that, it's very rewarding and comforting. So that's the services we are providing are phenomenal. We have had very good reviews in homes. We also take care of mothers who have babies, neonatals. Think someone out of the hospital after surgery, they are not strong enough to take care of themselves and their young ones. So we support them.
I was right there when I had my second one, but
how did it go?
It was horrible because I didn't have the care I needed. So that cuts deep in my heart. But now this is exciting. So is there anything that we have not had an opportunity to talk about regarding Vantage Care, or just the needs in the community that you would like to tell our viewers?
We have a training program. It's a very detailed program. Actually, we transposed the certified nursing home program from the US. It's what we are teaching in Uganda. And we teach it here. It takes a month. For us, it takes 2 months. So we are so detailed, and it's a new phenomenon in the country. So 4 weeks in class. And what do we teach? What we learn here. We learn these skills in class. But also, what I want to share is that it's not enough to go in class and learn the theory or the art of caregiving. Mm-hmm. The question of kindness, empathy, compassion, treating our clients with integrity and respect. Those are key important aspects of our training. The country is craving for someone who is very kind. Look, and I don't blame our nurses and our doctors. They are overwhelmed. And that's really the frustration of the nurse ratio in Uganda is 1 nurse to 23,000 people. How will you
good
ever?
Lord.
Yes, it's online and it's in the journal, the medical journal. You can find it. So that frustrates a nurse. That overwhelms them. They are burnt out, and I mean, the pay is not as good as you would compare with others. So they are also frustrated. They have no help.
Right.
Yeah. So given that the environment, the setup does not really give you attention and the dependability and the consolation and the support that you need. So we don't blame them for behaving the way they behave. However, 4 weeks of training, we emphasize on the behaviors in the home, treating our clients with respect, and then we pull them to the hospital floors. I can't thank enough Nakasero Hospital and Kampala Hospital. It has worked so well with the private sector. In Uganda, we have them spend another 4 weeks on floor, hands-on care. And that's where they gain their experience. So by the time they go in the community, they really know what to do.
Yeah, that is it's great work, and it's a lot of work. What I haven't told people in the public before is that I trained as a certified nursing assistant when I was in
for
Hawaii.
you. Good
Yes.
for you. No wonder I see some things. It's a great training. It is. I think healthcare begins there.
Yeah, for me, what motivated me was different. I was home alone with one child, and I was pregnant with another, and I said I needed to know the basic ways of, providing some form of care, not for seniors at the time, but for also my children when I'm home, in case there was. And so I went in, and then I got to learn more about the servicing, providing care for seniors and persons with disability. And it was quite a great experience, learning how to give the shots, learning how to position people. And I did the on-site training as well in Hawaii.
Good for you.
Yeah.
Yes.
And even, I learned how to lift someone when pregnant, because I was pregnant. But then I could still lift somebody safely. So it was quite I really, really admire and respect the work of certified nursing assistants, because it is, I feel that it's one of the underappreciated roles in our healthcare system, yet it is the most critical and crucial, because they are the ones in our homes taking care of our seniors, taking care of our loved ones with disabilities. So to every certified nursing assistant out there, I respect you and I thank you for your work.
So we have a list of services that we provide. We provide here, and the same services we provide in Uganda. Think about grooming. Grooming is, look at you. Your hair is well done. You had makeup. You dress so well. And myself too. To have an old person, an old gentleman with a shave, with haircut, with a clean dress or clean shirt. They have had a shower. They are not smelling. I mean, they have had their oral care. They are putting on very well. I mean, and they are in the comfort of their home. That raises their self-esteem.
It does.
There's a gentleman I know that was sick and went to his son's home, and so in-laws. were home, and the son went to work. But because of being sick, he had an accident in bed. He refused to eat. He refused to get out of the bedroom. He felt so embarrassed. He felt so bad that this happened in a home where the in-law was home with him. It's such a situation. So you are a man who has grown in a community with a lot of respect and dignity, and something has happened to you, and you can't call your in-law to come and help you clean. So he refused to eat from there, and then said, if this is the life I'm going to live, I want to die. But look, here you provide someone who knows that, yeah, he gets accidents. We can easily help you to the bathroom, help you transfer safely to the toilet. From the toilet, we can clean you, we can dress you, we can feed you, we can do your hair, we can shave you, we can walk with you, we can also dress you up in your suit and accompany you to the wedding of your grandchild.
Right.
I mean, you remain in community life that's dignified and normal. What can beat that? So those are the services that we want our people to experience.
No, that is amazing. Speaking of shaving, you know, I remember during the lessons, I did not know before then that there's an art to shaving.
Oh, yes.
You know, the razor has to be a certain direction. So it is a great class and a great experience. But healthcare is one of the things that I really, really like to see grow. I've been so proud to be a part of global health programs. When I ran for office, healthcare was one of my high priorities. So it is so exciting to have you, who is actively working to improve the lives and dignity of people in our community, here with me today at the studio. And I'd like to thank you for your work, your service, and to say that I can't wait to host you again to give us updates on how everything is going. So thank you again for being my guest today.
Thank you so much. And I also want to hear you for standing for your political career. I couldn't believe there is someone of your caliber. How daring that talks about how strong and how inspiration that was for most of us, especially in the diaspora. I mean, this country is built on immigration. I mean, to see a woman of color standing in Acton, a Munyakigezi, Muchiga woman, I cannot, I was always dancing a Chichiga dance for you. So thank you for showing us the way, and to be a presenter in the United States. This is an international television. I mean, where else can you find? It's only the Muchiga woman who can do this. Thank you.
No, we're in this together. And really, to our viewers, I want to just continue urging us. Healthcare is critical to the well-being of everyone in our community. So I hope you'll continue supporting everyone in the healthcare sector who is trying to improve the lives of everyone. For now, thank you for watching Healthcare Blind Spots. Till next time.